Hello everyone, my name is Nora Clark. I'm a master's student in the Masters of Nursing program at William Carey University. Today I will be performing the Flipping the Classroom exercise. My topic today is triaging a patient and performing vital signs. My audience is going to be pre-licensure students that's in their first trimester of nursing school. Now we will take a look at my PowerPoint that I created. My PowerPoint here, we already discussed the topic, but it's triaging the patient and assessing vital signs. The objectives. By the end of this teaching session, the student will know what triaging a patient entails. They will know about the acronym COSPA that we will be using to further assess our complaint illness. They will have an understanding of how to perform vital signs on a patient. They'll be able to show return demonstration of vital signs. They will know the normal range of vital signs and when they will need to report them to the MD. The goal of this session is that each student will have an understanding of triaging the patient and how to assess vital signs. What does triage mean? Triage is basically assessing the patient for the degree of their illness or complaint. For our assessment here, when we're triaging the patient, we're going to further assess the illness using COSPA. When you're assessing your patient, be sure that you introduce yourself first. Make sure that you let your patient know what you will be doing for them. And be sure that you get permission to provide care for your patient. COSPA. This is the acronym we will use to further assess our patient. We will start with the first letter. C. C stands for character. That's basically just describes what is going on with the patient. The patient will tell you their complaint. The O. The O stands for onset. Onset lets you know when the illness or complaint, pain, whatever's going on with the patient, when it first started. The L is for location. Where is the problem area the patient is having? Where is it located? D is the duration. How long has it been going on? S stands for severity. How severe is it? Is it just a little bit of pain, a little bit of problem, a little bit of congestion? Is it a lot? Can you please describe it to me? Pattern. Pattern tells, is it ongoing? Is it come and go? Just what type of pattern? Is it more in the morning or at night? And associated factors. What makes it worse? Does it get worse when you're hot or cold? Or does it get worse when you go outside? Just obtaining these little use this acronym to obtain information about your patient. It will give you a vast of knowledge and help you get to the root problem of the patient. And I believe the MD will be happy with you for gathering all this information for them. Okay, we're going to have a little interactive quiz with the COSPA. I'm going to give you a little scenario question, and you just tell me which part of the COSPA, which acronym letter it stands for. Okay, my patient comes in with a nosebleed and headache. First scenario question. How long has this issue been bothering you? Which part of cold spot do you think that describes? Which letter? Okay, the answer is D. This will tell you how long it's been going on. That describes the duration. My next question. Can you rate the pain of your headache on a scale from 0 to 10? 0 being no pain, 10 worst pain ever. I give y'all a little time. Okay. And that what describes the S in cold spot, which is the severity. Next question. Does anything make the nose bleed better or worse? My answer is associated factors. This will tell you if it's anything else that makes the nose bleed better or worse, and just give you a little more information about the effects of the condition. Okay, on to my vital signs. Vital signs, just for one, it's an assessment of the blood pressure, the temperature, the pulse, and the respirations. The vital signs is taken most time in the upper arm, right above the brachial artery. It's like a little arrow on the blood pressure cuff, and you line it up with your brachial artery. You would use a stethoscope to assess the blood pressure. You would pump the blood pressure up till about 160, 180, depending on what the patient would tell you is their baseline blood pressure. And the stethoscope, of course, will be placed over the brachial artery. And your blood pressure reading, when you're listening with your stethoscope and you're releasing the air from the blood pressure cuff, the systolic number will be the number when you first hear the beat of the heart. The diastolic number will be when you stop hearing the heartbeat. The normal range for blood pressure systolic is 120 to 140, and the diastolic 80 to 90. This number may vary depending on what's the baseline for the patient. You just need to look at the history and see what's going on with the patient, and from there you will know what you need to report to the doctor. The temperature, you can assess temperature orally, tympanic, that's in the ear, or they have a one that you can do on the head, and they have a rectal temp, but most time the temperature of choice is the oral temperature, and that's under the tongue. The normal temperature range is 97.8 to 99.0. The pulse will be assessed next. You can assess that at the radial artery, at the wrist. You use any of the other arteries. You have the carotid, the temporal, the radial, the brachial, the femoral, the popliteal, the dorsalis pedis, and the posterior tibialis. But like I said, the pulse of choice is the radial. You will you will feel the pulse for, if it's normal, about 15 seconds, but if it's abnormal, you will feel for a full minute. Oh, and I forgot about the apical pulse. That's the pulse you will listen with the stethoscope at the apex of the heart. And the normal range for heart rate or pulse is 60 to 100 beats per minute. And the respiratory rate, you could take it like when you're doing a temperature, or when you're most people do it with the pulse. They'll check the pulse for 15 seconds and the respiration for 15, and you multiply them by 4 to give you a full minute count. That's if they're normal. The normal respiratory range is 12 to 20 breaths per minute. As I said before, any deviations from these parameters, you make sure you check the history, and if it's not normal for the patient, you notify the doctor. All right. Here we have a little video on vital signs.
Vital signs. Position the patient properly. Confirm that the patient has not consumed food, alcohol, tobacco, or caffeine, or exercised in the last 30 minutes. To assess the pulse, properly palpate the radial artery located on the flexor surface of the wrist laterally. Count the pulsations for 15 seconds and multiply that number by 4 to find beats per minute. Count the pulse for a full minute if abnormalities are detected. Do not inform the patient when you begin to assess respirations. Count the breaths for 30 seconds and multiply that number by 2. Again, if abnormalities are detected, count for a full minute. To assess blood pressure, you must first select the proper cuff size. Sizes range from infant, child, adult, to large adult or thigh cuffs. An appropriately sized cuff will fall within the range demarcations when wrapped around the patient's arm. Cuffs that are too small may give falsely high readings. Place the cuff just above the elbow. Most cuffs have a marking that should be placed over the brachial artery, located towards the medial surface of the cubital fossa. Palpate the brachial artery prior to assessing blood pressure. Support the patient's arm at heart level. While palpating the radial artery, inflate the cuff until the pulse disappears. Deflate the cuff slowly to confirm the pressure at which the pulse disappears. This point is your estimated systolic pressure. Select the proper cuff size and correctly place the cuff on the patient's arm. Using the diaphragm of your stethoscope, place it over the brachial artery. Support the arm at heart level. Inflate the cuff 30 millimeters of mercury over the estimated systolic pressure. This avoids an unrecognized oscillatory gap that may lead to serious underestimation of systolic pressure. Deflate the cuff slowly, less than 5 millimeters per second, until you first hear pulses or Korotkoff sounds. This is the patient's systolic pressure. Keep deflating the cuff until you no longer hear these sounds. This is the patient's diastolic pressure. In addition to the wall mount, students should feel comfortable using both aneroid and digital sphygmomanometers. The key difference in the aneroid and the wall mount cuff is the display gauge. Most come with a clip that can be directly attached to the cuff, or you may ask the patient to hold the display gauge for you. While there are many types of digital devices, none require the use of a stethoscope, but you may or may not need to make
Okay, that was a little more detailed video. I liked it. I hope y'all liked it. And it gave you a little more information on how to assess vital signs. Okay, time for a little practice. We're going to take a break and let y'all practice with your partners on vital signs. If you have any questions, please ask. Don't hesitate. Please ask.
I didn't do a good enough job of coaching
Okay, back from our practice section. I have a little triage scenario here that I put together myself. If you want, you can just read through it and I'll describe it a little bit. It just kind of tells you to knock on the door to get to come into the patient's room, wait for an answer, and get permission from the patient to come into the room, and also get permission to provide care. Remember to introduce yourself. I just put a little statement there describing how you would do that. After you get permission, you're going to perform your triage, gather your history, remember the code spa. You take your vital signs, and after you finish triaging your patient, make sure your patient is satisfied before you leave the room. Let them know that the doctor will be in shortly. Ask them, do they need anything? This is just my little scenario I put here. I don't believe there's a right or wrong way, whether you take vital signs first or perform your history first, but just make sure that you get permission from the patient to provide care. And always remember to let the patient know who you are and what you will be doing. Okay, that's the end of my PowerPoint. It's time for questions. Any questions? All right, y'all remember, practice make perfect. Let's take out some time and go and practice our triaging skills. If you have any questions, feel free to ask me, ask your peers. Just ask. No question is a dumb question. That's the end. Thank y'all.